Hey, what's going on, TKS fam? Welcome to session 10. My name's Nadeem, and let's talk about cancer, specifically innovative cancer treatments. But before we dive in, let's understand the landscape. There are four main classifications of cancer: carcinoma, sarcoma, lymphoma, and leukemia. To give you an idea, carcinomas are normally the classification for lung and breast cancer. There are three main types of cancer treatments: surgery, chemotherapy, and radiotherapy. Okay, we got the basics down, but why are we looking at this? The lung cancer death rates have only dropped 2% annually from 2007 to 2012. Definitely looks like a huge opportunity to improve. Now let's talk about prevention. From 2005 to 2015, there's been a 30% increase in US lung cancer diagnoses, but the population only increased by 9%. Not doing the best job at prevention, especially since many experts agree that a third of cancer can be prevented just by lifestyle changes. Now let's talk about spend. Cha-ching. By 2020, it's estimated that cancer care will cost the US $156 billion per year, plus around $6 billion in research funding, which is the most funded disease area. That's more than the US imports on food and drinks combined. Innovative cancer treatments have the potential to cost less and win more. Okay, now let's get into some innovations. Photodynamic therapy, or PDT. It uses a chemical that binds to cancer cells to make them sensitive to light. Then you blast a certain wavelength through their special machine, and it destroys cancer cells in a more targeted and less invasive way. There's a case study against traditional chemo and radiotherapy for lung cancer. Year 2 survival rates were more than double that of the chemo and radiotherapy. That's pretty cool. CAR T-cell treatment uses your body's own T-cells to fight cancer. They extract your T-cells and engineer them to fight specific cancer cells. Early results are very promising in patients with lung cancer. The CIVO uses microinjection technology. It can test multiple treatments on a tumor at the same time. It saves a lot of time and reduces trial and error tests. Nanotechnology is also being explored to treat incurable cancers. In March 2016, UK researchers used a nanoparticle generator to hide cancer drugs inside nanoparticles. Once absorbed into cancer cells, the drugs are released and ninja-like assassinate the cells. Early trials in mice have completely cured them of breast cancer in only 8 months. I sense potential, young grasshopper. Your task today is to make a presentation on innovative cancer treatments or technologies assisting these treatments. Tell us how it works. What's the technology behind it? What are some early results? And why is it better than what we're doing today? That's all for today. Let's see what you got.